Hello everybody, Cleet Barrick here from beautiful Okinawa, Japan, here to present my Public Health 500 poster focusing on public health interventions in the treatment of tuberculosis infections prior to the development of effective antibiotics. You'll be able to find my poster in PDF form for closer review. Now there are a few major interventions that developed within the public health sphere prior to the advent of effective antibiotics, which is in the 1940s. I'll go through a couple of those that stood out. First of all, I'll look at the general public health interventions, so things such as improved sanitation, workplace safety environments, ventilation, as well as within housing. And that appears to have had a debatably significant effect on the decrease in the rates of tuberculosis infections within the United States and Western Europe. Most of these interventions occurred, again, sort of between the period of 1860 until the early 1920s, and you can see a generalized, almost linear downturn in the rates of infection. But some of the other interventions besides these generalized public health efforts include one that's not talked about a lot, which is the eradication of bovine Mycobacterium infections. So that occurred in the turn of the century, in the 1890s and early 1900s, and that was through a coordinated effort with public health officials, USDA, as well as the meatpacking industry, specifically started in Chicago. And so ultimately that disease was almost eradicated, and it's thought that almost 25% of Mycobacterium cases were caused by the bovine variant. Additional interventions that occurred prior to antibiotics include the sanatoriums. You can see a few historic images, courtesy of the BBC here, from said sanatoriums, and they included just a generalized attempt at sort of lifestyle modifications, health interventions such as high altitude, dry air, bed rest, and what we call heliotherapy, so sun exposure, and that's thought to increase the vitamin D levels and therefore improve the macrophage functions within the body, which are critical in fighting tuberculosis. So this was probably the primary methodology for treatment of tuberculosis patients in the really the 1860s through the 1920s, and it was relatively effective, again, with the downturn in cases, and part of that was the public health-wide effort of essentially isolating these cases of tuberculosis. They isolated them at the sanatoriums. And then the last intervention that I wanted to briefly focus on was the discovery of the BCG vaccination. So the BCG vaccination, as discovered by Dr. Albert Calmette, pictured here, was a live bacterial vaccination that, while not effective against pulmonary tuberculosis, which is the primary form of the disease, was effective against miliary or disseminated tuberculosis, and as well as tuberculous meningitis, which resulted in a lot of fatalities. So saved a lot of lives. And again, the timeline for the development is sort of laid out here. You'll be able to see that closer on the poster when you review it separately. But the first dose was introduced in 1921 after about 15 to 20 years of development. So that is about 80% efficacy in preventing the meningitis as well as the disseminated tuberculosis, still utilized today in countries with high endemic rates of tuberculosis. So I also have a timeline here that kind of outlines a few of the other interventions, but overall you can see through public health coordinated effort and multiple specific interventions, we've been able to cause or result in a substantially decreased rate of tuberculosis even prior to the discovery of antibiotics.